Hello, everybody. Welcome back to the Speech Collective podcast. My name is David Rosen. I'm here with David Harris. David Harris is the CEO and founder of the Dr Fluency Institute, known for treating stuttering and fluency disorders using scientifically proven innovative technology. The Dr Fluency computerized treatment program was co-developed with experts like Dr. Robert Kroll of the Clark Institute of Toronto and the Hadassah University Hospital in Jerusalem, and won the prestigious prize of the Prime Minister. The Institute has helped over 2,500 individuals overcome their dysfluency using the breakthrough award-winning Dr Fluency AI-based technology that finally enables effective treatment of a problem that had no effective known treatment, while gaining international recognition for the Dr Fluency success. David Harris regularly participates in public discussions about fluency disorders and the importance of early intervention. He has helped countless patients speak confidently, including myself. David, thank you very much for joining me today.
And thank you, David, for having me and for that wonderful introduction.
Thank you so much. To start things off, do you remember the first time I stepped into your office? What were your initial thoughts?
Well, David, if you remember, I had my first two US-based trainees join that first session with yourself and your father. And them being trained and licensed speech pathologists, I was thinking to myself, what are these two thinking? Because I knew that helping you, as motivated as you were then, wouldn't be that much of a challenge, since, like you said, I've helped countless kids in your situation. But since your dysfluency was quite severe, after taking more than a minute and a half to actually say your name, I knew that these two were thinking, there is no way that Dr. Fluency can help this kid, especially after hearing that you've been to the best that New York has to offer. So needless to say that 2 weeks later, they couldn't believe their eyes and ears when you displayed normal and natural fluency. And thanks to you, they'll no longer doubt that anybody can achieve good fluent speech with Dr. Fluency.
David, I have to correct you. I could not even say my name during that meeting. I had to tap my father's knee for him to say my name to you guys.
Actually, yes, that is correct. I remember that now.
Okay, so going off of that, what motivations did you have to begin Dr. Fluency? And was there a patient zero that you remember?
Well, regarding my motivations, having many years of expertise in software R&D, with expertise in AI technologies, computer recognition, voice recognition, I seldom had the opportunity to have such an impact on people's lives like I was privileged to do ever since I met Aryeh. He's actually the fellow that came up with the idea to develop the Dr. Fluency technology. That's an interesting story that's worth mentioning if we ever have time for that. But regarding the second part of your question, after 2,500 patients, it's hard to pinpoint a specific case because, thank God, each and every one taking the Dr. Fluency course is a whole world within himself. But I can tell you that when I met the first live patient for the Dr. Fluency project, a young fellow with a very severe stutter, and during the initial assessment, I actually asked him to give me an example of the impact that his dysfluency has on his life. The example he gave was that at the airport, he was taken for further questioning because due to his very severe stutter, the airport security felt that he was over anxious and perhaps a security risk. This was my first encounter with the actual difficulties that are involved with living with this problem. And that's actually what took me down the rabbit hole of understanding how difficult and how much of a life issue dysfluency can actually be. And this is a problem that is often referred to as a transparent disability. When you walk into a room, nobody will know if you're not fluent until you open your mouth.
So I know what you're talking about with travel, because I have had my own issues. During our stay at a hotel, I had to write a note on a note card to my sister telling her to order room service for me because I was unable to speak on the phone. So I know what it's like dealing with issues of speech during travel. So going off of that, what sets Dr. Fluency apart from the typical speech therapists? And how does it compare to traditional methods of combating speech impediments?
Well, first of all, in order to successfully deal with a problem, I think the most critical thing is to have a good understanding of what you're dealing with, meaning to have a clear understanding of the problem itself, which very often is halfway to the solution. And if you don't understand the problem correctly, your whole therapy approach will be off. For instance, if you think that you're dealing with a psychological disorder, okay, your approach will be very different than if you realize that this is a motoric physiological problem that these kids have with their speech production system. And I think actually that you're a real clear example of this point, because I've never met an individual who's sounder and healthier psychologically than yourself, okay? So trying to treat your problem as a psychological one, trying to build up your confidence perhaps without treating the underlying dysfluency, that would be a terrible waste of time. And actually, this is something you've experienced with such approaches in your past. Now, the other thing is you've got to be able to distinguish between the actual problem and all the side effects that it displays. Because then it's like treating a running nose and not the bacteria that's causing it.
Yes.
In our case, the real problem is the loss of control over the speech production system, and more specifically, excess pressure in the vocal cords that causes the dysfluency. And that's what leads to the side effects like stuttering or stammering or cluttering and speaking very quickly and clutter. So instead of focusing on regaining the control, okay, you might spend your time chasing after all of those side effects because they're more obvious visually. So first of all, like I said, understanding the problem. Second of all, being able to distinguish between the problem and its side effects. Because if you're not focused on rebuilding that control, okay, actually this is a process that requires you, as you noticed, to really learn how to speak from scratch, not in the sense of what to say. Nobody's going to teach David Rosen what to say to whom, okay?
Yes.
When I say to relearn how to speak, it's in the sense of how to use your speech production system correctly, how to breathe correctly, how to use the vocal cords correctly, how to use your articulators correctly. So that has to be understood in order to be able to go far. But even with a very good understanding of the problem, if you don't have the necessary tools to deal with the problem, and in our case, it's the technology, okay, that you realized and you saw how critical it was, because without the correct tools, you're not going to get very far. So even if there had been professionals in the past who did have a good understanding of the problem, without the necessary tools, they weren't really able to help. Now, I think this is very obvious from our experience in the past century that certain problems in our body cannot be resolved without the help of technology. And the amazing advancements that we've had in medical and paramedical fields because of the technology have shown us this. For instance, in our case, without the right feedback, okay, that you get from AI-based technology in Dr. Fluency, you'll never be able to learn things like fine motoric control over your vocal cords. You can't see them. So how are you going to learn to control them? And as you know, with Dr. Fluency, you're getting constant real-time feedback and then a clear evaluation on whether or not you did it correctly. So even if a speech pathologist understands that it's necessary to learn to control the vocal cords to prevent that blockage that you were experiencing, without the means, it's not going to go very far.
Yes.
I'll give you a quick example that I think the listeners would understand. When you want to learn to play the piano, you go to a teacher who obviously has to have a piano in order to teach you. Then, at home, you're going to have a piano or a keyboard to practice everything that you've learned in the lesson. Now imagine you go and learn it at the piano teacher, and you go home and you don't have a piano to practice on. You're not going to get anywhere, right? Now imagine in our case, where the speech pathologists don't have the tools, that's like trying to learn the piano from a teacher who doesn't even have a piano and then go home and practice on your kitchen table. So obviously that would be a waste of time.
So I've been to many speech therapists, as you know. They saw me for like 45 minutes a week and only gave me papers to practice the techniques that we went over during the lesson over the 6 days that I did not see them. And I didn't know if I was practicing them correctly because there was no feedback, no one to guide me through the practice. And thank God for Dr. Fluency, because you guys have the proper technology that can guide me through the way.
And just by the way, David, we actually invite speech pathologists from around the country to participate in the Dr. Fluency training program so that perhaps they themselves can help individuals like yourself.
So with Dr. Fluency, what is the average timeline of when you see patients really improving their speech patterns?
Well, actually, David, there are 3 stages to the course if you think back of the process you went through. The first stage is the speech improvement stage, where you're actually learning how to speak correctly using the Dr. Fluency technology. Now, the minimum requirement is half an hour a day. And if you do spend half an hour a day practicing, typically you'll be able to speak fluently within 2-3 months. In your case, where you were able to and you were willing to dedicate a few hours a day, you completed that stage within a couple of weeks. However, we don't consider that to be the end of the course, because at that point, what we need to do now is transfer everything that we've learned to do in the clinic and using the Dr. Fluency tablet to your real life situations, real life speaking situations with your parents, and then with your family, and then with your friends, and then going out on the street, if you remember, walking into Grand Central Station and asking all those questions like we did, and making phone calls. So that's what we call this transfer stage. But even then, the course isn't over. We will typically accompany a patient for a whole year, making sure that they're practicing correctly and progressing and not, God forbid, experience any kind of relapse. Because as you also remember, at certain points during the year, if you slack off on practice or what have you, you might experience a relapse, but no biggie. Yes. Within a couple of weeks of good practice, you're back on the horse, and that's what the Dr. Fluency team is there for.
So I know you've had some difficult patients, like in terms of speech, but what are some of the most difficult patients that you have had to work with in your life?
Well, actually, we never found that a patient would be difficult because of the speech impairment or even its severity. But actually, you can hold testimony to that. But rather, it's only difficult when a patient isn't motivated enough to take on the process, because look, half an hour a day is no biggie, okay? You know that. You sit down, you start practicing, boom, half an hour is gone, right? But the consistency here is what is a challenge, and pretty much with everything in life, as you're old enough to know. So really, it's only the motivation that is the the number one parameter when it comes to success. And by the way, this is why we always hold a free eval with the patient and the immediate family. First of all, to educate them about the problem and how to solve it, but no less important, to make sure that we have all the necessary motivation and that motivation is there. And I actually hope that this kind of a podcast can help with bestowing that kind of motivation.
So when it comes to early intervention, what signs should parents or educators look for to seek out speech therapy?
Well, first of all, the curious thing about this problem is that the onset will typically be between the ages of 3 and 9. That shouldn't surprise anybody. Pretty much every problem in the human body has a certain, I call it an expiry date, right? Like myopia, short-sightedness. That'll typically, the onset will be between the ages of 5 to 15. I needed glasses when I was in 3rd grade, right? I saw perfectly till then. So that's not a surprising factor, that suddenly the boy who is speaking very fluently will start blocking, and the way to diagnose this is when you can tell that the boy knows what he wants to say. And by the way, of course, when I say boys, I mean girls as well. But interestingly enough, this problem is 4 or 5 times more prevalent in males than females.
Wow.
So you'll notice the child knows what he wants to say. He knows exactly how to say the word. He said that word a million times. But sometimes trying to say the word like mommy, he'll block. That's when you know that that is a dysfluency. And of course, it's worth going to a speech pathologist because A, there are early intervention methods such as LidCom and so forth, which is worth trying. And second of all, I think the most important thing is the guidance to the parents, because they have to know that they have an important role now, because their reaction to the child's dysfluency could have serious impact. If you're showing that child that you have a problem listening to him, then obviously that child will develop not only the dysfluency, but also avoidance, which is much, much worse.
Yes.
When it comes to educational staff, identifying this child could be pretty difficult because, as we said before, if the child isn't opening his mouth, nobody knows that it's happening. So sometimes it's a very apparent stutter or stammer. Very often it could be a clutter, a very, very rapid speech rate and unclear. But very often it could be just that quiet kid sitting in the back of the class and nobody actually knows that he has a dysfluency. So as part of what we do is we also try to have meetings with professionals and educational staff in order to promote the awareness and the understanding that they have a perfectly normal, very talented child sitting there in class. But just like people have trouble hearing and people have trouble seeing, some people have trouble speaking.
So do you think there are any misconceptions about speech impediments that the general public has?
Do you usually speak in understatements? Because that has to be the biggest understatement, because I think you probably noticed that when you had a severe stutter, the reactions that you would get were of total bafflement. People don't understand what I said before, that just like there are kids with hearing impediments and vision problems and need glasses, there are children who have trouble speaking. And for some reason, that stigma, where if you see a child who has a problem speaking, then perhaps he's suffering from some emotional or psychological disorder. Yes, we said that when you have trouble speaking, you might develop avoidance, anxiety in speaking situations, problems with self-confidence and self-esteem, but they're the side effect. They're not the problem. They're not the cause. It's the opposite, actually. So yes, and we find that educating people about dysfluency is no less important than treating it.
So me being trilingual, how does knowing multiple languages play into treating speech disorders?
Well, objectively speaking, there's no real difference because the dysfluency, that pressure in the vocal cords, that neurological disorder or twitch in the vocal cords is pretty much language agnostic. In your case, because you're trilingual, you'll find people who are dysfluent find that in their mother tongue, their vocabulary is better, they'll be more fluent. Because as you remember, one of the tricks you used to use is when blocking on a certain word, you try to replace it with another. And when your vocabulary is very good, you have a lot of leeway. And when you're speaking another language where your vocabulary is more limited, I had mentioned Aryeh, he immigrated from the Soviet Union to Israel. He learned some Hebrew in the Soviet Union, but he says that for the first 6 months, he was practically dumb when he came to Israel, because in Russia, and speaking in Russian, it's a very, very rich language, vocabulary-wise, and he was always able to try to find a word. But in Hebrew, when he had only 500 words in his vocabulary, if he would block, that was the end of that. Yeah. When it comes to therapy, the interesting thing is that practicing in only one language won't necessarily automatically affect the others. So you're going to have to practice, as you noticed, in all three languages in order to improve your fluency.
So to your point, English was much easier for me at the start of my practice and at the start of my journey of speech, because I took your course, Dr. Fluency, in English, and then realized, like a few months later, that I had to practice in the other languages that I know as well. Now, how do you see the role of technology impacting the future of speech therapy? And how will Dr. Fluency adapt to these changes?
Well, technological advancements, and now with AI going through the roof, you can always fine-tune your technology and always get better. Although Dr. Fluency actually does a very, very good job with the feedback it needs to give, as you could tell. But where I see that the advancements are going to help is in being able to train speech pathologists using the Dr. Fluency method and Dr. Fluency technology. I am expecting serious advancements as far as that's concerned, as well as I am hoping that there will be serious advancements in hologram technology, so that when you're sitting across the internet, it could almost be like sitting in the same room, other than like on Zoom where I can hear you, can you hear me? 1 minute, I can't see. So right now the technology isn't ripe enough for that, but I do expect there'll be serious advancements in that respect.
Okay, so to wrap things up, if you could give one piece of advice to someone who is currently struggling with a speech disorder, what would that advice be?
Well, first of all, you've got to realize that you're actually suffering from a simple neurological disorder where there's excess pressure in your vocal cords. It's not that big a deal, okay? Although it does become a big deal because it's not that simple, because of the life issue that it could create, because it prevents a person from communicating normally. But I think the most important message would be, don't give up, okay? Yes, with a little serious dedication and motivation and daily work, you can reach amazing results,
Yes.
David, as you've just
As
displayed.
I have, yes. Thank you so much, David, for doing this interview with me. I really appreciate it, and I hope to have you on soon again.
I will be more than happy to come back.
Thank you so much. Thank you.